One of the problems that we see is that there's fragmentation between the discharge process and then the follow-up once the person arrives home. So the patient leaves the hospital and it kind of is left on their own to manage new medication regimens, to perhaps see a new specialist or a physician. And often it can be chaotic and difficult for someone to follow up on their own. Care Network has been preventing avoidable hospitalizations and emergency room visits for many, many years. We provide a seamless continuum of care from hospital discharge back into the community setting. The essence of this program is to approach basic needs first. If food, housing, and shelter are an issue, then managing a chronic disease is not going to be a priority for this individual. When we make a home visit, we send a nurse and social worker together so that both the basic needs and the medical needs can be addressed comprehensively.
When I first met Antonio, the first 2 or 3 times he would not let me into his home, which kind of led me to believe something was going on, maybe embarrassed, I wasn't sure. Then I finally convinced him to let me into his house. And when I walked in, the first thing I was a strong smell of mold. The walls were covered with mold, drapes, clothing, food. It was all over the place. His living conditions were not a place where somebody can stay healthy. Soon after we saw this deteriorated home, we were able to get him into a much better situation. Now he's more stable. Then Monica comes in and takes care of all the medical needs.
Antonio was a patient that would consistently use the hospital emergency room because he didn't have access to medications. He has made major progress from the time the case was open until now. He's starting to take care of his health.
It really does take a village to provide these services. It's not the hospital alone. We work very closely with our community partners to provide what I call a very tightly woven safety net for these individuals so that they can't fall through the cracks. Reducing hospital readmissions is a win-win for the hospital, for the patient, and for the community.
Lo más importante es que su salud está bien y vamos bien con